Who is that? No, not who that is. It's funny.
Oh, so you just press recording.
All right, so am I unmuted?
Yep.
Yeah,
you're
everyone
good.
can hear me. Let's do a sound check to make sure that the sound is okay. They'll kind of text you on there
Yeah.
to make sure everything's okay.
Okay, I can hear you now.
Yeah, everything's good.
Yep.
Okay. So I'm just going to go through all the MMTs of the cervical spine and the trunk, which is there's not a lot of them. And because there's not time, I won't leave time for you to practice. You can go back and watch those. We're working on kind of making sure we can put out the recording of the video soon. So the first one we're going to do is we're going to do all of the neck flexors together. So this is the SCM, the longus coli, all of the deep neck flexors and the SCM together. So the first thing you want them to do is you want them in supine position, and the hands are up over the head. The reason why the hands are up over the head is you want stability of the thoracic spine on the table so they can move their head off of that stable position. So the hands are up, and the book shows it a little bit differently than I'm going to show you because the book doesn't put a hand behind the head for support, but I want you to always have a hand sort of like in the back of their head. You don't have to hold them, but it's there just in case and to give them a feeling of comfort. So what I want him to do, I'm still in the picture.
Mm-hmm.
Okay.
Good.
So what I want him to do here is I want him to tuck his chin, and I want him to lift his head up off the table. But because we're testing the deep neck flexors, I don't want him to come off the table leading with his chin. So if he does that, as we discussed in lecture, if he leads with his chin, we know he's using his SCM more than his deep neck flexors. So in this position, he's going to tuck his chin, he's going to come up off of the table, and then he's going to come back down. I'm going to stand to the side of him. I can put my hand just kind of back behind his head, just it's there. It's not going to hold his head, but just in case. So go back down for me. I'm going to have him tuck his chin, and I can palpate the sternocleidomastoid first. Go ahead and tuck your chin, and then come up. I can see it contract, and I can palpate it. And then I can also palpate, this one, find on yourself. It's going to be right along the anterior lateral portion of the vertebrae of the cervical spine. So it's pretty deep, and you'll feel as they come up, you'll feel that muscle contract. So my hand is back here. I'm going to go right pretty deep here, have him tuck his chin and lift up. And now that he's there, go ahead and come up. He's going to hold that. I'm going to take my hand and just gently push on his forehead. Hold, 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 and then relax, and then put him back down. So notice my hand was always behind his head. I'm pushing on his forehead, and that's partially what you have this hand back here, so that when I push, I'm taking the pressure off of his head, but my hand is here. Just in case he were to give, I'm not going to shove his head down to the table really quickly. So I want some support, and he's feeling a little bit more comfortable that my hand is there. He can relax now, and I can put him back down. So there's no gravity eliminated position for this. We're just testing all of the cervical flexors, making sure that he keeps his chin tucked and that he's not using his SCM over his deep neck flexors. You will find in ortho, we'll do a test that's more aimed at testing the endurance of the deep neck flexors. So for this one, it's just generally, can they hold their head up there? And you're going to realize that you don't have to push very hard. Like most people cannot keep their head up there for very long. And if you push on it hard, they're going to want to go back to tips. Just be careful and cautious of that. So that was for neck flexion, longus capitis, longus coli, sternocleidomastoid, all those deep neck flexors. Any questions? I'll wait just a second in case I have some. Good?
Yeah, we're good.
Okay.
Where do we palpate?
Oh, so for palpation, they're here. Number one, you're going to palpate on I'll do it on this side. You're going to palpate on the sternocleidomastoid, which will be very obvious. You'll be able to see it when they come up. So that's one palpation area. The other area, you're going to palpate all of the deep neck flexors on the anterior lateral side of the deep cervical spine. So you're right along the vertebral body. So you have to kind of get in there fairly deep, palpate, and you'll feel those muscles kind of pop out into your finger. So those are two places you're going to palpate. Anything else?
I know the book says longus coli. Is that specifically, do you want us to palpate the longus?
Oh yeah, that's the same. No, for palpation, just palpate all the deep neck flexors as a whole. You're not going to be able to palpate one over another. It's too hard to tell the difference. Yeah, good point. Just palpate like deep for all the deep neck flexors and superficial more for the sternocleidomastoid. Okay, there's no more questions. Then we'll do the sternocleidomastoid by itself. So I'm going to have him in the same position. Hands are going to be up over his head, and I'm going to rotate him away from me. So I'm going to stand on this side. I'm going to have him rotate away so that now when he turns, you're going to be able to see the sternocleidomastoid very clearly. And the motion I want him to do here with his head turn, because I'm just testing one side, I just want him to flex up, so bring his ear towards his chest and then back down. So very easy to palpate just the SCM. Go ahead and come up. My hand is back here behind his head. Gonna hold that for me. I'm gonna push now on the side of his head back towards the table. Hold, hold, and you can see that it's not a lot of pressure. He's starting to shake. And if he can't hold that, what you'll notice is they're gonna turn and try to use both SCM because we're just trying to test the left only. So let's reset that. So I have him with his hands up over his head. I'm standing on the side I'm testing. I'm testing his left SCM. I want him to rotate to the right side, just rotation only. I'm going to put one hand behind his head. I can palpate here. The motion I want him to do is just bring his ear down towards his chest. And then I want him to hold that there. Hold. This hand's going to move. I'm just going to gently push here. I've taken the pressure off on this hand. It's just there in case. Hold, 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 and then back down. Not a lot of pressure. The muscle's pretty small. And if you push too hard, they'll just turn their head, which will make them use both sides. So again, no gravity eliminated, just 5, 4, 3. You got to use your judgment on that, the lower ones. Questions on that?
So when testing the SCM, are we pushing straight down or with a slight rotation?
Straight down. Yeah, excellent question. So because he's already rotated, and he's already rotated, and I just want him to come up. I'm just singling out just the SCM on that side, so I'm just going towards the table. They're going to probably rotate just a little bit, so he's going to come up here. And when I push, he might rotate a little bit, but I'm relatively pushing straight towards the table and not very hard.
Good.
Good. Anything else?
We're good.
Good.
Yeah.
Okay. All right, so now we'll come around and we're going to put your head in the hole. So for this, we're going to put your arms at arms up. Well, we can start there. So I'm going to have them supine prone on the table, use the head hole for this one. And I also want his arms up here, flex, so we can stabilize his upper trunk. I'm testing all of the cervical extensors together. So there's a long list of them, the capitis, all the muscles that produce extension. And we're just going to do them all together as one muscle. So you can palpate on either side of the spinous process for the group of muscles on either side. Again, the book has you stabilizing here, but I want you to have a free hand to kind of hold the head and be able to palpate the muscles of the cervical spine, the extensor muscles. So what I'm going to ask him to do is I want him to lift his head off the table and just extend and look up slightly. So I'm trying to avoid him just doing cervical extension, like upper cervical extension, or just trying to do retraction. I want a combination of both of those movements. So I can palpate on the same side I'm standing, hand in front, and then go ahead and come up. Good, that looks good, and then back down. So now I know he can do it okay. He's gonna come up again, and then I'm gonna just turn and just push with this hand here. Ready, and hold. Hold, I'm pushing gently, building up very, very slowly. I still have a hand in front just in case. Hold, 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 and then relax, and then I'll put him back on the table. So always have a hand in the front on the forehead so that they feel comfortable when you push on the back of the head. That's kind of a unnerving feeling. So just to review, the hands are up. You can palpate, you're gonna feel the extensor muscles come into your fingers as a big group of them on either side. Palpate those, have them extend, and just look up slightly, hand in front, and then push down towards the table very gently. Relax. Questions on that?
We might just have to do the placement real quick.
Okay.
Okay. People, I guess the camera was just, I could see it fine. I could see it fine on here, but they're saying that they, just the camera needed to be higher. Can't see that. Okay. They say that's good.
We're
Just,
good now?
yeah, we're good. Just,
Okay, let's try
maybe
it.
just the placement, just show your hand
Okay.
placement. Yeah.
So palpation wise, we have the spinous process. We can palpate on the same side that we're standing for the extensor muscles. I want him to just lift off the table and then go into slight extension of the upper cervical spine. So when he does that, I'm going to palpate on this side. I'm going to have one hand in front. So when he comes up there, he's going to hold that right there. I'm going to keep my hand there. I'm going to turn and just gently push on the back of his head. Ready, and hold, 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 and then relax. This hand that's in the front, I can slowly lower him back down so there's a little bit more comfort level there. Yeah. Questions on that one?
No questions?
No questions. Okay. Let's move now to the.
Does it matter if your fingers are facing superior when you push down?
Oh, I see. Like versus here.
Yeah.
Yeah. So when you have one hand in front, I would just prefer that your fingers are facing superior. You're just pushing down this way, as opposed to pushing down that way. That way, it's you're always normalized to pushing in the same direction that you're going. As opposed to if I push this way, I could turn their head a bit. So it's just better to go straight towards the table.
Perfect. Got it. Cool.
Okay. Let's do the rectus abdominis. So we'll flip around, head down the other end. Yeah. I don't know if we can adjust the camera.
Yeah.
Head this way. Okay, so we're gonna put him on the table. This is now measuring strength or MMT of the rectus abdominis. And I want him supine on the table, have the head at the end of the table that doesn't have the cutout. It'll just make things a little bit easier. This is one of those few MMTs where you're not actually gonna stabilize their legs. The reason being is if I stabilize his legs and I'm gonna have him come up and do a sit-up, then he can use his hip flexors. So I'm actually gonna monitor to make sure when he sits up, he doesn't get a lot of hip flexion, and that's going to assure that he's not using too much of his hip flexor to get into a sit-up. So he's on the table. I'm going to start with his arms behind his head, so hands behind the head. I'm not stabilizing. For palpation, you can palpate on the same side that you're on, just lateral to the umbilicus, and that will be palpating the rectus abdominis. So I'm going to palpate here. Before I do that, I could actually show them. I mean, most people kind of understand what you're asking them to do, like have them do a sit-up. But if need be, I could show them. I just want him to come up this way and then back down. He doesn't need to come up all the way. All I'm looking to make sure is that the inferior angle of the scapula clears the table. So that would be a 5 if his arm's over his head. So I don't need him to come all the way to sitting. I just need him to come about halfway up, making sure the inferior angle clears and then I can actually see that angle. So he's here, hands behind the head. I'm going to palpate here. He knows the motion he's going to do. So I'm going to make sure to try to keep these legs down and just use your muscles here to curl up. So go ahead and try that. I can see his inferior angle comes off the table and then back down. So that's a 5 when his arms are behind his head. So 5, palpate. I can see the inferior angle clear, muscle grade of 5. No pressure needs to be given. For a 4 now, I'm going to have him cross his arms across his chest. So he crosses his arms, I can palpate. Go ahead and come up. I'm watching here. Good, back down. So he gets a little bit of hip flexion, but a little bit is normal, as long as he's not overly using his hip flexors. So that's 5 was behind the head, 4 is across the chest. Now this one is a little different. Arms at the side, and he's going to come up and clear. That is a 3+. So if he comes up with the arms at the side, the inferior angle does clear the table. That is a 3+. So we're going to do the obliques a little later, and the 3+ is a little different. So just keep those two separate in your mind. And then for a 3, he's going to try to come up he gets part of the scapula off the table. So that is now a 3. The arms are at the side. He's just kind of facing down this direction. So he's not using the table. His arms are just at the side. And then, so that was a 3. And then a 2 is he tries to sit up, but the scapula remains in contact with the table. So you might see the top of the scapula come up, but for the most part, the majority of the scapula is on the table. That would be 2. And then a 1 would just be I see or I palpate and I feel muscle contraction, but there's no movement that occurs. So the reason why the arms behind the head is a 5 and this is a 4, you're basically making the center of mass closer to his head, so it's harder to sit up. So hands behind the head would be a 5 because your weight's a little further from your axis of rotation. 4, the weight is getting a little closer to your axis of rotation. 3, you've gotten the weight even closer, and then we just do 3 and 2 from that position. So questions on that one?
Can you just go over the difference between a 3 and a 3 plus one more time?
Sure. So a 3 plus, the arms are at their side, and they come up and they clear the inferior angle. So their whole scapula comes off the table. That's a 3 plus. A 3 is he does come up, the scapula does leave the table, but the inferior angle does not clear. So it doesn't come all the way up. The whole scapula does not leave the table. That's a 3. And then a 2, he tries to come up. Maybe the very top of the scapula leaves the table, but for the most part, the scapula is staying on the table even though he's trying to come up. That's a 2. And then 1 is I can just feel the contraction of the muscle.
And then do you always start from 5 and then work your way down?
Yes. And I get the argument, the argument always is like, what if they're weak and you start with the 5 and tire them out before they get to 3 and then they can't test, right? But you just always test from 5, 4, 3 down. Yeah. Any other questions?
I think we're good.
Good. Okay. So now we're going to do the oblique muscles. So for the oblique muscles, I'm going to have them in the same position. However, unlike the abdominal muscles, I am going to stabilize down at the lower femur, so right above the knees. So I want him to have something to kind of push off of, because I'm going to have him sit up and rotate. So if you remember from lecture, the obliques kind of run at an angle. If we talk about the external and the internal, and then the external and the internal. So external, internal, kind of at an angle here. So if I'm going to have him come up off the table, so this come up this way, and rotate towards the side away from the side I'm standing on, so back down. Because if he rotates towards me, we're going to come face to face, right? So I want him to rotate away from me. So if I'm having him come up and rotate to his right, you don't have to come all the way, just kind of, as long as your steps are clear and then back down, that's good. Then if he's rotating to the right, I'm testing his left external and his right internal. When it comes to palpation, you're only going to palpate the external obliques. Don't worry about the internal. So for the external obliques, you're going to find the rectus abdominis just above the umbilicus and go lateral to that, and you should be able to feel the external obliques here. So now his hands are behind his head. I'm palpating external oblique. Go ahead and come up and over. And I'm making sure that both scapula clear the table. That's a 5. So I'm palpating, hands behind the head. He comes up off the table, rotates away from me. I stabilize. That's a 5. A 4 now is arms across the chest. I'm going to palpate here. He's going to go up and away from me. Both scapula clear the table. That's a 4. Now arms at your side. So there's no 3 plus here. We're just going right to 3. So I'm holding here. He's going to sit up. Both scapula clear the table. That's a 3. And then for a 2, he's going to try to come up, but he cannot get the scapula off the table, just like the one before. And then for a 1, I'm just going to palpate the muscle for muscle contraction. So the 2 differences between abdominals and the obliques. Abdominals, I'm not stabilizing. For obliques, I am going to stabilize. And then there's a 3 plus for the abdominals. For here, we just go back to 5, 4, and 3. And 2. Questions on that?
Yeah. Can you go over what's what's the a 4 grade again on for the external obliques?
Sure. So the 4 grade is the same as it was for the abdominal muscles. He's going to come up. He's going to clear both scapula off the table, inferior angle or both off the table.
Okay. And then could you show where you palpate exactly? Maybe if you kind of roll over towards me,
Yeah.
you can kind of yeah.
So like here's the abdominal muscles here going down. You're just going to come to the side of that. Maybe you could probably just go to the umbilicus. That's fine. Okay. So just lateral to this here, you're going to palpate right there.
Okay.
Okay. Good.
And then just what side are you palpating for when they come up?
Sure. So go on your back. If he's going to come up and go to his right side like we've been doing, I'm palpating his left external oblique because that produces right rotation.
Okay.
Yeah.
And then just this your state. Can you go over it one more time? Just where you stabilize exactly?
Sure. I'm stabilizing on the femur here, distal end of the femur, so he has something to push off of.
On both femurs?
Both femurs.
Okay.
Yeah, good question. Do you know how to get it out of the?
No.
No?
I can ask them.
All right. Yeah. Okay. All right.
Good. Yeah, we're good again.
All right, let's do extension. So I'm going to go on the stomach now. So for extension, we're testing all the erector spinae that we were talking about in lecture today. So we want them in a prone position with a pillow underneath their abdomen. So we want to, that way we're not in too much lumbar extension. So when we do that, they've taken all the pillows away from us, I think. We've looked everywhere. I think they're in quarantine or something. I don't know where they went. So this is the best we have. So we're going to put something just so their spine is a little bit more neutral. They're not going to go into too much extension when we ask them to extend. And he's going to start with, let's go the other way. That way you can put your head. So let's use the whole side so that he can put his head in that hole and it's a little easier for him. So his legs are going to be straight below, and I'm going to actually stabilize here so he has something to lift off of. So he's going to put his hands behind his head for the 5. I'm stabilizing here, and you're going to be it's very easy to see the spinal extensors coming on either side of the spinous process. About maybe an inch away, you'll see the muscle bulk there. You can palpate anywhere along there, it's fine. You can palpate on the same side that you're standing or the opposite side or both, it's fine. So I'm going to stabilize here. What I want him to do is I just want you to kind of lift up off the table in this direction. Right? So when we were looking at the abdominals and the obliques, we were looking for the clearance of the inferior angle. And for the extensor muscles of the spine, we're looking for clearance of the whole sternum with the xiphoid process as your landmark. So if I'm stabilizing here, can you go ahead and come up for me? I'm going to palpate, and I just want to make sure I take a look. The xiphoid process is off the table. So if his hands are behind him, that's a 5. Now if his hands are behind his back, kind of in the small of his back here, I'm going to still stabilize him here, palpate there, go ahead and come up. So now we're at a 4, good. And then I'm going to put his arms at his side. He's not going to push on the table, he just has them at his side, relaxed. I'm holding here, he comes up again, and I want to make sure the xiphoid process clears. So make sure you visually check to make sure that's off the table. So I can give him a 3 for that position. So 5 was behind the head, 4 is behind the back, 3 is down at the side. 2 would be that they attempt to come off the table. The xiphoid process doesn't clear. 1 would be I just feel the muscle contraction. Questions on that?
You palpate on both sides of the erector spinae.
You can palpate on both sides, yeah.
Questions?
Okay. Last one then is elevation of the pelvis. So on your back. So we're testing the quadratus lumborum, which is a muscle that can help with hip hiking. It is also an extensor. And so we're going to test the hip hiking ability of that muscle to hold there. Can you rotate, just kind of roll towards me? When we palpate the muscle, find the iliac crest, find midline, so it's like right in the midline of the thorax here, and then go just behind that, and you're going to take your fingers right above the iliac crest, because it goes from the iliac crest to the lower ribs, and just gently kind of pull in here. And then when he does the motion, you will definitely feel the muscle. So this is one of those that you know you're on it because the muscle will contract quite hard. So find the iliac crest right up here, go right above it and back behind the midline of the kind of the lateral midline. Feel right in there and then have him do the motion. So go ahead and lay on your back. So I'm just going to reach over the table. It's probably best if you're on that side, but just so you can see. So here's midline here. I'm going to pick my fingertips just right back behind so I can feel the muscle right above the iliac crest. And the motion I want him to do is I want you to kind of bring your pelvis up towards your armpit. Back down there. Good. So try that again for me. All right. So I can now reach behind here. Try that. The muscle will very easily pop into your fingers so I can feel that. So we're good. All right. Now, there's a couple of things that are helpful here. It's helpful to have their shirt off because then they'll stick to the table a little bit more, but they also are allowed to hold on to the table when you do resistance and when they move. That's fine. So I can have him bring his hip up. I've palpated, it all feels good. Can you still see it from over here?
Yep.
Okay. I'm going to grab, so here's his lateral malleolus, medial malleolus. I'm going to grab just right above that. You don't want to grab their foot because then you traction through their ankle joint. So just right above that, you grab with two hands. I'm going to have him bring his pelvis up towards his armpit, hold there, and I'm just going to pull him down towards me. This is a fairly strong muscle, so chances are you could put all your weight behind it and see if you can see the tip moving. So I'll give him a 5 there. Your muscle grading goes back to your typical muscle grade. So 5 is max, 4 is moderate, 3 you can't is minimal, right? They can go through motion, but you can't put any force on it, and then so on and so on. Any questions on that?
Where do we grab when distracting the leg from the hip?
Okay, so we're gonna, here's the lateral malleolus. I can do it. I'll just turn it. Here's the see, okay?
Yep, that's good.
Lateral malleolus, medial malleolus. You're gonna grab right above that. So my hands are on the tib fib joint, and I'm just pulling straight down towards me. Just kind of leaning back into it while he's trying to hike his hip.
And how do you differentiate between a 2 and a 3 from this one?
So just your typical muscle grades, like you would grade any other, like the biceps muscle. So 3, they can go through the full motion. 2, they can't go through the full motion.
Okay. And then where do we stabilize during active range of motion?
There is no stabilization during active range of motion.
Any other questions? Okay. Can you show the movement again?
Sure. So the movement I want him to do is I want him to bring his pelvis up towards his armpit and then back down. And then just to review the muscle grades, because I think, let me just clarify this. So he can go up and he can hold against max resistance, right? That's a 5. He can hold against moderate resistance, that's a 4. He can hold against minimal resistance, that's a 3. And just, I think to correct what I said before, because this is already gravity eliminated, a 2 is he can go through the full motion with no resistance. I bet that's a good point. Because it's gravity eliminated. So technically, if you can go through motion, that would be a 2. Anything else?
Any other questions?
Okay, so we will work on finding a way to upload the video. That's it for today. So practice those, and you can get checked off on all of those if you have already finished your palpation of this other one, palpation of cervical spine. And then so the next thing we have to do is palpation of the pelvis, and we will do that next time since we haven't totally covered that yet. All right.
And then you mentioned that this will be posted online.
Yeah.
Okay. And then can you just go get a couple more questions on differentiating between a 3 and a 2 for this last one?
Sure. Yeah. So that was my fault. It was unclear. So a 3 would be they can pull up and they can resist against a very small amount of resistance. They can hold it there. A 2 would just be they can do the motion because it's gravity eliminated. So that's the typical 2, but I can't put any resistance on it.
I think we're good.
Yeah.
Yeah. Any other questions?
Okay. Well, that's it for today. Hopefully we'll be in touch, and we'll let you know when those videos are posted and where. We just have to figure out how to compress them and put them up. Okay.
Thanks, guys. How do I end this?
Okay.
So stop here.